What's up everyone? Happy 2020. Welcome back to Sagar Says. What we're going to talk about today is an advanced filler injection technique called the cannula technique. So first of all, what the hell is that? So a cannula technique is when we, instead of using a sharp needle, we use a completely dull needle to inject it. Now, why wouldn't you do that in the first place? The thing is that you need a needle to pierce the skin and create a little tunnel. Once you have a tunnel, you can pass another smaller needle right through that same hole and then direct it wherever you need be. This leads to less needle pokes, which means less bruising, less swelling, and less pain. So first, let's talk about this from the patient's perspective. So if I was doing the lips, for example, I can put two little holes right here, and through those access the upper and lower lips and even the nasolabial folds. This means that when you leave, instead of having a lot of different injection sites along your lips, you have one hole, and through that, the needle is passed in both directions, and you're gonna get a lot less pain afterwards because you don't have all these needle pokes making you feel like a pincushion. You're also gonna get a lot less pain during, because the only part that hurts is that initial poke, because sliding that blunt needle through is a lot less painful. This is something that also, more importantly than anything, leads to less major complications. The biggest complication that so many injectors forget to tell their patients about, and more importantly, so many patients who feel that fillers are simply like getting a haircut, forget to realize there's something called vascular compromise. When this thick filler is injected into an artery, it clogs up the artery. Some of these arteries supply the blood to your skin, and it can kill that skin. And if you've ever seen someone with horrendous bruising or even a blister looking thing, that's most likely because they had vascular compromise. Immediate and urgent treatment is necessary. You got to treat them with aspirin, warm compresses, and injecting the dissolving agent, which is called Hylenex. When you have a blunt cannula, instead of piercing the arteries and vessels, this kind of slides around it theoretically, and that leads to much less incidence. Is it possible? Still, yes, but it's much less likely in my honest opinion. Now, there's a lot of different options out there. The one that I prefer is called Magic Needle. This needle is a little bit longer than your traditional cannula. It's also more flexible, which allows you to move where you want to go. If you've ever used a cannula for different areas, the key things are going to be finding the right length cannula and the right diameter cannula. You have to have different options. If you just stick with one cannula for everything, you're going to find the cannula very difficult to use. When it comes down to it, when you feel these cannulas, they're very flexible. There's no sharp points, so you can touch the tip of it. There's no issues, and more than anything, it's something that will make the patients comfortable. Now, from the injector's perspective, this is an advanced technique. It takes some practice. The things that you're going to want to do in order to master this technique are a few fold. So there's nothing worse than using the cannula technique and not being able to find the hole that you made with your initial needle. The secret to that is putting in the needle in there, sliding it deep, pulling it out slightly, moving it in all the directions that you're going to want the needle to begin to go in, and then leaving it there. Leave the needle for a good 30 seconds and let it do its work in creating that initial channel. From there, when you remove the needle, you're going to want to give a slight nick to the very skin edge to make that opening a little bit even larger. I was actually mastered this technique because when we do facial fat grafting, we take fat and put that into the face to add volume. It's a similar technique with even larger cannulas, and that's where we mastered this. That's where this concept comes from. Now, once you've gotten your needle happily in there and directed it to where you want to go, remember, plane is still important. Remember that you still want to have an even distribution of the filler, and more importantly, make sure you get it in all the places you want. Now, if you have any questions or want to schedule a consult with us, please feel free to reach out. If you have any other questions, leave a like or comment below.